exercises that I use a lot in terms of some core and some hip stability, particularly for people with low back pain or people who have too much kind of that side to side motion in their swing, is we call a half kneeling Pallof press. So what Chloe's going to do is she's going to have her left knee down on the pad, on the stability trainer, and her right leg in front. And she's going to have her right leg directly in front of the stability trainer, so she has a super narrow base. It's not too wide of a base. This is going to challenge her medial lateral stability as well as her balance because she has a narrow base. I like this half kneeling position a lot because in this position her legs are kind of disadvantaged. They don't get to help her out as much. And so it's really forcing her hips and her core to work to stabilize her and balance her as opposed to our legs. A lot of the people that I see have pretty strong legs and they don't really know how to utilize or even activate their hip and core muscles. So this position pretty much forces you to do that, or otherwise you'll fall over. And I really like exercises that are self-limiting like that, where the instructions are don't fall over. From there, we're going to use the CLX band, and she's going to have both of her hands in the loop, and she can grip it from there. And she's just going to have her hands close in. On the other side, you can attach it to a stable object, or you as the clinician can hold it out to the side. From here, she's just going to press or extend her arms away from her and then back in. So we're going from a short lever arm where the band's close to her body to a longer lever arm. When the band is trying to pull her this way, her body is having to fight to not rotate. So it's an anti-rotation exercise. In order to do that, to not fall over, or to not rotate back towards the band, her hips and her core have to activate, or again, otherwise she's going to fall over. And so we can just have her do that kind of back and forth. If we want to make it more challenging, we can increase the angle of the pull. So this time, once she brings her arms away from her, then she's actually going to bring it up overhead. And then back down and that close to her body. So again, just trying to maintain that good posture, that good stability as the angle and the force is changing. If I want to make it a little bit more dynamic, I can actually start to throw in some perturbations. So we think what stability is, your ability to stabilize through your core, is your ability to accept unexpected perturbations or unexpected challenges. So whether we have a soccer player who running down the field, someone knocks into them, they don't necessarily just fall over and collapse, they're able to kind of right themselves. That means they're able to accept that perturbation. Walking down the aisle of the grocery store, someone bumps into me, I don't just fall over, I'm able to accept that perturbation, right myself, because I have that good stability. And so that's even true with our core stability for golf. So from here, she's just doing this pattern of movement, and I'm going to give her an unexpected perturbation, give her some little tension on the band. Can she right herself and not fall over? I can actually let go of the band a little bit and reduce the tension. Is she able to control that, or does she fall over? And we can increase the speed in which we do that and change up the direction of the pull a little bit with that. Again, just challenging her stability as she goes through the exercise.